Hi Christian, my name is Kristen and I'm a physical therapist. The information you gave me was limited, but what it consisted of is that you saw a doctor who told you you had a cervical strain. That's a very general term for pain in your neck. There's a lot of different, if I was to physically assess you, there's a lot of different things that can contribute to pain in the neck. So I'm going to give you a very general way to begin treating yourself, and then if this approach does not work for you, then I would like you to get to see a good physical therapist. But a lot of times it sounds like your symptoms just gradually came on, you're not sure what you did, is what you told me, and that your neck hurts when you turn from side to side, or I'm assuming you meant to say when you yawn. So since there was no injury involved, not a specific point in time, but it has gone on for a few months, that I'm going to give you some just general advice. The first thing is that I need you to correct your posture. Oftentimes we spend part of our day in this position if we're working on the telephone, talking on the telephone, or sitting in front of a computer. Those kind of postures can cause a lot of pain in the end of the day. And often we don't experience it as pain, it might be just fatigue. You go to bed, then you wake up in the morning stiff and not sure what you've done. So the first thing I want you to do is really try to take a look at what you do during your day that could cause this pain. If it's talking on the phone, even for just a few minutes in this position, I want you to stop that. Get a headset. This kind of posture, even for 2 or 3 minutes during the day, can really cause these muscles to tighten up. Then, correcting your posture, I want you to lift your shoulders up, back, and down, and put them in this position here versus how we often carry ourselves with forward rounded postures. As soon as we get ourselves in a good posture, it really reduces the stress we put here on our muscles. Then some things that can help is always controlling the pain is by controlling the inflammatory process. So putting an ice pack around your neck, wrapping a cold pack around your neck, keeping it on for 15 minutes, utilizing that 2 or 3 times a day for the next 2 days should really help control any inflammatory process that's there. Then doing gentle shoulder circles backwards. I only want you to go backwards because even without seeing you, most people have a forward head, rounded shoulder posture, so we want to just strengthen and loosen up those muscles by doing shoulder circles backwards. The next is I want you to gently stretch your neck muscles by dropping your ear to your shoulder. You should feel a stretch right along here through your upper trap and upper cervical muscles. You're going to hold the stretch for 15 seconds. Count slowly to 15. Then I'm going to have you slowly drop your chin towards the armpit, and you'll feel a stretch further back on your neck, and holding that position again for 15 seconds. Then you're going to slowly sit up and do the same thing on the opposite side, ear to your shoulder. You're going to feel a nice gentle stretch, holding it for 15 seconds, and then slowly drop your chin towards your armpit and holding that for 15 seconds. And I want you to perform that stretch 2 times on each side. So correcting your posture, looking for things throughout your day that could keep your neck aggravated, utilizing cold packs to really calm the inflammation down and calm any irritation of the muscles, and then shoulder circles backwards and the gentle stretch is what I'm going to have you work on. If that seems to help you, that's great, and I can give you a progression of exercises that will help you get all the way healed. If these things don't help at all, what I want you to do is seek out and find a good physical therapist in your area that can appropriately diagnose and give you a physical therapy diagnosis and appropriately treat your neck. So I hope that answers your question. If you have any further questions, please feel free to contact us. Be well.